Hello and welcome to another episode of Sisterhood of the Scalpel. I am Dr. Julie Khanna.
And I'm Dr. Maryam Zamani. And as we promised to you, we're here to answer some of your burning questions. This is our inaugural session, so please stay tuned. And if anything spikes your interest or you find that you have questions you'd like to submit to us, please do so and we'll do our best to answer it as soon as possible.
So we're going to be doing this again. Let's start. One of our first questions came out was, what's the best way to reduce acne scarring? Well, I'm going to tell you the best way, first of all, is prevention. Seeing a dermatologist, getting good skincare, medications, whatever is needed. We even have lasers that do help as well. But if we've got acne scarring, we look at the different components of scarring. We look at the color, we look at the depth, we look at what can we do for that type of acne scarring. So sometimes it's lasers for the color, like red or browns. Sometimes we even need to cut some of them out because they're a little bit deeper or pitted acne scarring. And then we do a lot of lasers, laser treatments to resurface. Kind of think of it like sanding down the skin when it's that shallow, kind of irregular acne scarring. And most commonly, it is a combination of all of those. So acne scarring is very, very varied. It's best treated with a combination dermatologist and plastic surgeon to give you the best results.
So this is a really great question, what happens in a nose job, but it's also a little bit too broad for the scope of answering. It's really important when we talk about nose jobs, or otherwise known as rhinoplasty, to know that we're addressing the nose. The nose has both what we like to say form and function. So sometimes we're changing the appearance, sometimes we're changing its function, which is helping with better breathing, and sometimes we're doing both. Now, the nose is a very complex structure. It's not only made of the skin that lies on top, but underneath it is a complex structure of different types of cartilage and bones. And depending on what we need to achieve, whether in terms of improving breathing or improving how the shape of the nose looks and how its outward appearance is, we change those structures differently, but in a manner that they work together to give the ultimate end goal. So sometimes that may mean taking away a little bit of the cartilage, reshaping the cartilage, adding the cartilage, or even sometimes addressing the bone, shaving down a little bit of bone, sometimes moving the bones gently together, and ultimately allowing the skin to redrape on top and give us the appearance that we want to achieve with it. Very much similar to how you make a complex multi-layer cake. You have the foundations, you build on that, and then the on top is the fondant that goes on and forms the ultimate shape and cover of the cake. So if you want to know more about this, this is a very important thing, is to see a board certified surgeon so that you can have the appropriate assessment, see what your nose needs, what we need to manipulate, change in whatever fashion to achieve the results that we want.
So Dr. Z, it's always about cake and food around here, isn't it? I don't know why surgeons are so obsessed, but we are. So let's talk a little bit about facelifts. We had a question talking about facelifts and what are threads, because threads are all over social media right now and everywhere. Well, I'll tell you something. I put in the first facial threads in 2001, so it is not so new. And they're very good, but when I look at threads, and I've been looking at them for the last few years all over the world, been for training, to me, threads are almost like a filler. And you're going to see the people who are doing the most threads are the dermatologists, the GPs who do filling, because they're really like solid filler. And until I see threads that are giving me a true technical visual difference that I don't have to question which is the pre and the post, I'm holding back. 2001, the threads that we had were really good, but what we found, because they were long-lasting threads, that after a few years they could slip or irritate and would need to be removed. I think we are on the precipice, I can't even say that word, forget it, on the edge of what's going to happen with threads in the next little while, because they are improving and improving, and I think you're going to see. We are excited about bringing threads here. The ones that are coming to Canada are around the corner, so stay tuned, and we will be talking about them. Till then, facelift versus other modalities. So let's talk about smaller modalities, even if it's not just threads, because I don't think you can replace facelift with threads, but you can do things like mini neck lifts, small local procedures, small scars, little bits of tucks that can buy us some time before it's time to do our full facelift. So there are a lot of options out there. We do a lot of radio frequency. We combine these technologies with our surgical technologies to give you quite an improvement without going all the way to the facelift right now. So come in and talk to us about what's right for you, because it does vary from person to person.
All right. So this is a really great question. Something we talk about often is when you have a facelift, no matter what age you have it at, how long do the results of a facelift last? So the way to think about a facelift is it's like turning back the clock. So if you take the hands of the clock, we're turning back the dial, and typically we say we turn it back on average of 8 to 10 years. So the second we let go of that, the second the scalpel goes down, the second the procedure is finished, that clock hand starts ticking away again. So we know we haven't been able to stop that. We're just resetting the clock back. The important thing to know is how do you protect your investment going forward so you're able to enjoy it further longer. There's a lot of different upkeeps that we can employ. You want to use things such as toxins that help to weaken the muscles, that pull our brows down, give us crow's feet and things like that. They can really help promote the longevity of your results. We talk about how the volume of our face changes with aging. So we say how we become, from more of an upside down L shape to more square. That's one of the characteristic things. We lose fat in some areas, like around our eyes or in the cheek area. So even though a lot of times with facelift, we restore those fat pockets to where they should be, we do a little bit of fat transfer to augment it. We know that sometimes to maintain those volumes, we may still need to use some filler for upkeep. And the number one thing you can do to invest in your health of your skin, but also its appearance, is to make sure that you're practicing good sun safety, staying out of the sun. And when you are in the sun and all year round, wearing sunscreen appropriately, reapplying it, and also using appropriate skin products. This is really important because there are tons of products out there, and I would really advise you to see someone with great knowledge to advise you on what products are best for you. And we, of course, have a whole host of other treatment options available that can help with the quality of skin, whether that is employing mild lasers or even some of our technologies that we love, such as radio frequency, all of which help to build up our collagen in our skin and restore its youthful qualities. These are all things that we can employ to help the results last even longer for you.
From face to body. And we're going to start with talking about breasts and breast implants. And this is a really timely thing because a lot of women are coming with concerns, what's been going on in the media with breast implant associated lymphoma. And you can see some of our videos on that, or just aging and time. And they may have had breast implants put in 20 years ago. I've been in practice for 25 years. So I'm seeing patients that I saw in 1995 saying, okay, I'm now done with my implants. And we have to think about breasts. And breasts and implants both age, and they don't always age at the same time. So that can be one of the reasons as well that we may need to consider some surgical intervention. When we're looking at implant surgery and implant removal surgery, we need to address both of those issues. Where are the breasts at? Where are the implants at? So breast implant surgery is not like a one simple answer. We can take out the implant, but what else do we need to do? Do we need to do a lift? Do we want to put some volume back? So maybe we want to think about fat grafting or things like that. So there are so many options out there, and sometimes we combine it all. So we need to look at every individual patient and every individual patient's needs, wants, and desires to help pick the right operation for you. But do know that it is an operation we offer. We see a lot of patients for this. And let's come in and talk about what you want to have done.
Excellent. So this next question is a pesky one, and unfortunately we don't have the best answer for it just yet. We know that stretch marks happen because of skin damage from a lot of stretch being placed on the skin all of a sudden, whether that's been due to weight fluctuations, growth spurts, or of course, pregnancy. What we can do in terms of best trying to amend it and improve it, unfortunately not erase it, are ways that we can help improve the quality of the skin. So whether that is utilizing good skin products or some of the radio frequency mechanisms we have, where it's almost like micro needling, going deeper through the skin to deeper layers and helping to stimulate your own skin to tighten up a little bit more collagen to be built up, that can help improve the appearance of it. But unfortunately, we still don't have anything that erases it, and don't listen to any of those fake commercials that say otherwise.
The red ones are good. We can get rid of those a little bit easier, get rid of the color, but it's that quality. You know, I wish we had an iron. We could iron out skin. That would be so good, because that would answer one of our next questions is what can we do with cellulite? And, you know, even cellulite, there are different types of cellulite. What Dr. Z just said, sometimes it's actually stretch marks that people are talking about. Sometimes it's loose skin. Sometimes it's denticellulite. So we have so many different options that are out there to improve all these, but none of them race. Well, let's talk about the easiest one. And this is kind of funny because it's a newer treatment called Selfina. Dented cellulite, those pock marks, almost like, oh look, my tufted chair, almost like these dents in the tufted chair. We have something called Selfina, and we're actually a teaching center for Selfina, where we can release those in a very controlled setting under local anesthetic. Selfina is pretty cool. It's easy. You come in, you get it done, and it really has a great improvement on the dented cellulite. It's like if I remove that button and the stitch that's underneath it, and this would then pop up. So not only does it improve the dented cellulite, but it often improves the shape of the buttock when we do it. So that's cool. Stretch marks, loose skin, using that radio frequency skin tightening devices. That's really changed the game. We can use those under the skin and on top of the skin. We have some called microneedling, like Fractura, like Morpheus, or we have even something called Profound, which is needles through the skin to deliver that radio frequency. So before, unfortunately, I would have said 5-10 years ago, I got nothing. You know what? Now we got lots, and we just got to pick and choose. But it's not an iron, it's an improver. It doesn't erase, but it definitely does improve. So we're going to keep working on it. We're going to keep researching it, and hopefully soon we'll find even a better answer.
We're on the precipice of new discovery.
Oh, you had to do that, did you? Did you look it up? Wait a minute. Did you look it up first? Did you cheat? Because I couldn't say the word. You had to look it up. No, I'm not even going to go there.
All right. Well, thank you so much for tuning in to another session. Again, please do submit any questions you have to us. We love providing you with information and helping to guide your decision making.
This is Dr. Julie Khanna and Dr. Maryam Zamani from the Sisterhood of the Scalpel, and we look forward to seeing you next time. And please subscribe, check below for links, and follow us on social media.